Excellent job with your clinical quality indicators and outcomes. We're very proud of you here at Healogics. I'm very proud of you at the hospital, I'm sure, as well.
In 2015, we were awarded the Center of Distinction, and then 2016 and 2017, we received the Center of Distinction and Center of Excellence.
Okay.
The Center of Distinction, the difference between the Center of Distinction and the Center of Excellence is the number of years open, as well as the numbers are a little bit higher as far as the benchmarks that we have to meet.
Okay.
So for the Center of Excellence, patient satisfaction scores have to be greater than 92%, healing rate has to be greater than 94%, and then we have to be doing like some of the business side of things as well, making sure that patients are getting what they need and meeting all those criteria. We have like clinical practice guidelines we follow, so we have to show that we're proving and following those. Press Ganey patient satisfaction surveys, they're sent out independently every month and then returned. I'm proud to say that we actually have a 98% patient satisfaction, which is phenomenal. So we work very hard with our patients to try to give them the best care and meet all of their needs. We have a phenomenal clinical team. I was blessed with a great team of providers. They work well together. I'm lucky enough that on Wednesdays, all three of the providers are here. They collaborate with one another as far as different patients that they might one physician might be seeing the patient, but they think the other physician has more experience in that area, or if it's a surgical concern, we'll sometimes bring Dr. Stoutenberg in. It's just a great team of clinicians, and we're all here for the right reason, and that's for the patient. Whatever is going to be best for the patient. I like to tell patients when they come in that this is probably the most undoctor-like doctor's office they're ever going to be at. Biggest reason is that the patients are expected to come every week. The more often we see the patients, the better the plan of care, the better the adherence to the plan of care, and the more often we can make adjustments to the plan of care. You get to know the patients. Our patients aren't generally here just for maybe 3 or 4 visits. We have patients that are here for 6 months to a year because of the complexity of the wounds involved. You get to know the patients, you get to know the family members. They get to know you. You see them in the community and they're like, oh, hey, did you go out this week fishing? Or were you doing this? And it's more of like a, I don't want to say a family environment, but it's a very relaxed environment. Yes, we still like our patients to follow a lot of rules, but it's handled in a slightly different manner than I think most physicians' offices handle things. It's not, you will do A, B, C, and D. It's, this is where we need to be. How do we as a team get there? So it's a lot of patient involvement. It's a lot of compromise on both of our ends. So then that way, patients are getting the best care and it's not putting inconveniences unnecessarily on the patient.
Ooh.
Do you want the door closed or you want to leave it open?
Yeah, let's close it.
All right. You'll feel a little clip.
Put this up on her so she can see.
Excuse me, pardon me. We're just going to go ahead and lock the deer in the chamber. I should probably just keep this off. I keep having it on. So it's actually a lot roomier than you would think it is. And that's, a lot of patients worry about being claustrophobic in it, but because they can see all the way around and they can move around, it's not a problem. So you'd have to be in there for 2 hours. It's not too bad.
Yeah.
Yep. Yep. When we have the head set up or the hand set up, we talk this way, but then when the hand sets down, you can talk and we still hear you. It is. It's constant air movement. There's constant airflow.
Is there like tape?
Magnets. It's for my
They're
board to write on.
when they're
fell off.
in Like now, before the
Does it kind of
machine's
look like
on,
an
there's no
H?
movement, but
And
then
I
once
was
the
like,
machine
but it
turns on,
looks
they
like
feel
it
the
needs to
airflow
be
like a
done.
fan going. But that's really the only sensation that they have. Mm-mm. Alrighty, we'll get you out now. You're such.
Go like this.
She missed
I
my
missed
Vanna.
it.
She missed Vanna. It was your one and only shot. I'm giving you my kids time now too. Oh, there you go, Miss Chelsea.
Well, that is very neat, honestly. Thank you for that too.